Hello, everybody, and welcome. I am so excited about today's guest because a big part of what we do is just try to educate you on everything out there in the healthcare space. And it's really impressive when we're able to get a dynamic individual on who is so great, gives back to the community, is passionate, hardworking, an avid volunteer, but also is a person who has suffered from a rare condition and can really bring her story forth and educate all of us on a disease called acromegaly. She'll make sure to pronounce that very correctly for you when she comes on and make sure that you understand the details. But this diagnosis really changed Monica's life and required her to get support and education and awareness that wasn't really readily accessible to her when this happened. And so part of her mission in life is to get out here and educate people, help people identify if they have this rare illness sooner, help people understand what this is so they can support friends, family, community members in managing this pretty serious disease. And early treatment leads to better outcomes. And so the more that we can educate, the better it's going to be. So I am super excited to bring onto the show today Monica Cufino. Welcome, Monica.
Well, thank you, Erin. Happy to be here.
How did I do with my pronunciation? That's the first question of the day.
You spot on. You're a professional.
Okay. We got it played off here, right? So I'm just really excited to have you on. I met with you and just learning about your situation and feeling the passion that you had for helping others, not obviously yourself, of course, through this process, but just helping others and paying it forward to help people identify what's going on and get early treatment and better outcomes. That's a big deal for you. So I'm super excited to have you on. And I always like to kind of start the interview, just take a step back, right? Because you're a whole person, right? You're more than this, right? And it doesn't define you, but it's become a big part of your life. And I just thought maybe it's helpful just to connect with the audience and tell them a little bit about yourself, who you are, what you do, and what your story is.
Sure. So basically, I'm just a regular person. I love to be outdoors. I'm a very active human being. I've always enjoyed hiking, love to cook, love to spend time with friends, love to explore new things. I'm married. I've been married for, just a little bit over 18 years. Thank you. I consider myself a social person. For example, during the pandemic, I was one of those people that was destroyed because I couldn't get out there and be around people. I'm definitely not an introvert. I'm an extrovert, and I've worked almost all of my life. I've been in sales, outside sales, inside sales, but always been somehow customer or client facing. So it's important that I keep up appearances and I'm able to perform my duties. When I make a promise to a client, I want to be able to be there. So That's made this so shocking.
Exactly. Well, and then I think about that, Monica, and I think this is what was my aha when we talked, right? Because I think a lot of times when we think of conditions out there and things that happen, we're looking to find a reason, right? It's, someone's not healthy, they're not taking care of themselves, they're not out there, but you're the poster child, right? You're doing it. You work really hard, but you have balance, you give back, you're a family person, you exercise, you're outdoorsy, you're social, you're all the things, right? But still something happened, right? And this is like what a lot of people are facing is certain illnesses and so forth. And it just comes on and, without explanation, right? And so tell me a little bit about what is acromegaly? Because when we first met, I hadn't really heard of it before. And I feel like there's a real gap in education. And I talked to a lot of people about a lot of different health conditions and I hadn't heard of it. So would you mind just describing for everybody what it's all about?
Sure. So first, to kind of put it into perspective, I think the numbers are 3 out of every million people I think it's in the US. I put the numbers down, but basically 3 per million per year in the United States are diagnosed with acromegaly. So that's what makes it so rare. So, so there's roughly 20,000 people that have been diagnosed with acromegaly now. And the population in the United States, only in the United States. Um, so acromegaly is when your body overproduces growth hormone. When you're a child and your body overproduces growth hormone, then it turns into gigantism. So people like Andre the Giant had gigantism rooted in acromegaly. When you're past your growing stage and your bones lock and you no longer can experience gigantism, instead other things start to grow. But what really makes what the catalyst for the acromegaly is a tumor that's located on the pituitary gland. And it's not uncommon to have growths on your pituitary. Um, it's when they start causing problems. And there's other diseases that are actually can be associated with a tumor on your pituitary, like Cushing's disease, and there's some other ones out there. Um, but but that's usually where that tumor is found. Sometimes it can be found in other places in your body, but it's the way it's diagnosed ultimately is through blood tests and glucose tolerance tests. So you have to go through a battery of tests.
So just to take it a step further, just to make sure that I understand. So obviously you talked about the childhood onset, right? Creates gigantism. And I think Andre the Giant, it's like the perfect example. People can understand what that is. And that
Right.
happens when it happens in adults, which sounds like it's more common. Is that correct? When it
Yes.
happens in adults, are their organs enlarging or what's happening inside? That's a direct effect of this disease. What's happening in there?
So anybody who's affected or who has been diagnosed with acromegaly will experience growths everywhere. So if your bones aren't growing because you're too old, then your joints and your soft tissue is growing. Your heart, your liver, your kidneys are trying to grow. Your heart valves are trying to grow. Everything is trying to expand. So and it's very common when women get it. It happens usually like around menopause. So it's
Right. Along
hard.
with everything else, right?
Yeah,
Like,
everything else.
gosh,
What
another
a
one to
great
add to the
time.
list, right? Good times. All right. Well,
Yeah.
that kind of drove me. I mean, obviously, so this is what's happening inside the body. What are the typical signs and symptoms of what's going on here? Do people have pain from the growth? Does it show on their outside? What are they seeing usually when this is occurring?
So there's all different on different levels of this. So some people start to have physical signs where they actually start their brow bone starts to stick out, their jaw starts to come out, they develop an underbite as their face starts to grow and their joints and their muscles start to pull. Then they start getting a split in between their front teeth. Their noses get your noses the nose gets wider. Your hands get bigger, your feet get bigger, your ears can grow. But the most common thing associated with acromegaly, the first thing, are your hands and feet. Because when you're, I think I was in my mid 50s. My hands and feet should not have been growing at that time.
Right.
And so you can only, you can associate it with, well, maybe it's menopause, maybe I put on weight, but not with the feet. The
Right.
hands, sometimes your hands get chubby. I
Right.
understand that. But the foot situation was really kind of odd. Um,
Right. So those
so
were kind of your first indicators where your hands and feet were was it like swelling? Did it look like, or you could tell it was actual growth? Like, how did you identify that?
I had no idea what was going on. I was like, oh man, my feet, my hands, my shoes aren't fitting me right, and my hands are getting bigger. But that's not the symptom that got me into the doctor to get diagnosed.
What was the symptom that brought you in? What happened?
So I was snoring, and I was snoring so loud that my husband said, honey, you sound like you've got a monster inside of you. You have to do something.
Yeah, he's like, honey, you're a monster. You need to go.
There's something going on. So, I mean, so once he said that, then other things, and I did have other things that happened at the same time. I'd also had been um, taking like a kickbox class, and everybody was slimming down and getting, all toned and everything. And I was getting bigger, but I wasn't slimming down, and my calves on my legs got really big. I couldn't like zipper my boots and stuff.
You're like, this working out thing is not paying off, right?
Yeah, it's like, I'm not liking this at all. But so I knew all these things were going on. But when he told me about the snoring, then I called my doctor's office and I insisted on seeing an ENT because the system that I was in at the time, I didn't want to get tossed around. And this ENT had the forethought to actually schedule a CAT scan so they could see what was happening in my head, in my sinuses, because that's what we figured is the sinuses.
They have never caught it without the CAT scan. They wouldn't have been able to see it.
It would have taken them a long time if they wouldn't have done the CAT scan. And what the CAT scan revealed was I had a tumor on my pituitary, and they referred to it as an adenoma. So first of all, I didn't know where the pituitary was, and I didn't know what an adenoma was. And then when I found out it was all in the middle of my head, like right here, back there, and attached to your brain, that was like, whoa.
That gets your attention really fast, right?
Yeah. Yeah. But if they hadn't
they did that so early, what do you think? So I'm curious. So let's say they hadn't diagnosed, you're fortunate that right away you went to somebody really you advocated for yourself, got into somebody good who was thorough and helped you identify this pretty fast. But what would have happened to you physically had it delayed for months or years?
So my tumor was extremely fast growing. They're not always fast growing. They can be super slow, but mine was. I would have gone blind, and I would have had a tumor growing inside of my head. So who knows? It could have caused that would have just been from the tumor. From the growth hormone, then other things. I was experiencing extreme joint pain. I had started having problems with my lower back, and after diagnosis and as things moved on, I went through periods where I could barely walk and was using a cane because it had swelled the area around my lower back. And I just have a genetic thing going on there with my vertebrae, but it just put so much pressure on it that I could barely walk. And I thought I was going to have surgery. And then they couldn't perform the surgery on that area. So there were a lot of things that were happening, and it's all around this swelling and growth. So if it hadn't been diagnosed, it would be horrible.
It would have been horrendous. And what type of treatment do they give for that? Like, how did they get this under control?
So there's different routes people can go. The first route is to have surgery and get the tumor removed. And I had a fairly large tumor, about the size of a walnut. So to get that removed, they have to do what's called transsphenoidal surgery usually, and they go through your nose and back behind your eyes, and they drill a hole and they resection it. So you can imagine the surgeon that does it has to be the best.
Right.
It's advised not to have anybody do that. Your surgeon has to perform the surgery at least 500 times.
Wow.
So you don't want to just go to somebody, and you don't want to go to somebody that's got kind of more like a general surgery. You need to really go to a place that's highly specialized. So that's one way to do it. And you would have surgery, and then if you're still producing, if your growth hormone levels are still high, and they actually do that by measuring your IGF-1, which kind of mirrors growth hormone. But the way it's produced,
IGF-1, is that a blood test that you take, or?
Yeah, it's an insulin-like growth factor. That's the gold standard for measuring growth hormone levels in people, because it tests it through your liver and it gives it so it doesn't fluctuate. It's like, this is a real reading.
A real valid number.
Right. But if that's still high, then they would put you on medication. And there's different types of medications out there. The medications they can be very rough on you. Some are better than others. They're working on newer ways. Most of the medications are administered through, you have to do it as a shot. So either you go in once a month and get a really big shot with a needle like this, Or there's other types. I took a medication where I was able to administer it at home, and it was like a little mosquito needle type thing, and I
Right.
would inject daily. And that either that's going to debulk the tumor, um, and help to suppress the growth hormone, or in my case, because I had the surgery, um, they and I had some other things after it. I didn't just have surgery. After that, I also had gamma knife radiation. So that's another route. So it's
Right.
surgery, medication, radiation.
Wow. It's a big process though, for sure. And thank
Yeah.
goodness in your case, they caught it early. And I guess as you were saying all this, first of all, it's just so detailed and such a big deal, and just so hard to believe that more providers and more people are not more educated on this. And you were just, divine intervention that, you found the right connection and were able to get diagnosed. I'm guessing that that's not the typical experience for most. What is being done to educate, rare diseases, right? But what's being done to educate the provider community, to educate the public? How are people learning about this?
Well, all doctors are, when they go to med school, they're taught what acromegaly is. But as far as educating doctors, it's really it's hard especially when you're like, I live in the San Francisco Bay Area, and we have some of the best medical institutions in the country here, and a lot of medical students too. So it's not, although maybe doctors, you might see a doctor that's never treated anybody with it because they're brand new or only a few patients, at least they know about it. But it's
Right.
when you get out to these rural areas that don't have doctors that are as educated, or maybe you're only seeing a nurse practitioner that has, just doesn't specialize in pituitary issues.
Right.
Uh, it's really just being able to, I guess, pharmaceutical companies do a big push and try and
Right.
hit up all these places. Uh, the acromegaly community that I participate in, our leader Jill gets out and she advocates across the country
That's
for
huge.
acromegaly. But it's
Right.
a hard one to raise awareness with. It's not like breast cancer or leukemia, where you've got a huge part of the population that's dealing with it, and it's also a huge money maker.
Right.
Acromegaly is rare. The medication is outrageously expensive, and it's really hard to identify because you have to connect a number of dots. I mean,
Right.
honestly, like you said, it must have been divine intervention for me to get diagnosed
That
like
was
that.
amazing. And look at what you're doing, giving back and helping people. I mean, I just think you're awesome. So I'm so glad that you're sharing your story with us and being vulnerable to do that, because it's hard always to put the message out there, and you're really helping people by doing this. So thank you. One of the things I was curious about, Monica, just, taking a step back, because I feel like I'm getting a good feel for what the symptoms are and some of the challenges, but I'm just wondering, when you're managing a condition like this, a rare disease, what are the unique challenges that you face as an acromegaly patient? Like, are there unique things compared to any other sort of autoimmune or cancer, or even all these terrible things that people deal with and tolerate? What do you think makes your situation unique, or the of patients in your situation? What's unique about it?
Well, the first thing is when something pops up, a new ailment or some new comorbidity, it's your endocrinologist can only handle so much. You still have to see primary care physicians. So you still have to explain to them and get through to them that I'm having this happen. I think this might be associated with acromegaly. So you still end up kind of fighting your way through the system to get the type of medical care, full, that complete 360 medical care that you really need. The other thing is, because of the medications, the one that I was on needed to be kept in under certain, like in the refrigerator. It couldn't go over a certain temperature, so it needed to be in always in a cold environment. So traveling got really complicated. We'd have to plan everything out, my
Right.
husband and I. We bought special coolers, that type of thing. I have to set aside, it's like every night, well, got to do my shot.
Right.
uh,
It becomes a
so
major driver in your life. One of the things that you mentioned earlier was that taking the medications is can be hard on you, right? So obviously you're talking about the aspect of the travel, but are there some bad side effects as well?
So some of the medications will destroy your gallbladder. It's just the way it is. So many people have these other things that are happening. The medication that I was on had the least amount of symptoms, and I say was because I'm in remission.
Right.
So yay! So I'm not on anything right now, and I'm one of the lucky few. Um, but yeah, so gallbladder issues. It can do other things to your digestive tract. They're really harsh. Some of them are in the same category as like some cancer
Right.
medications.
So it's
It,
intense on your body, and a
it's
lot of it's benefiting one thing, but always there's a benefit analysis, right? What else it's affecting. So that's crazy.
right.
Well, congratulations on being in remission. That is
Thank you.
amazing. Keep that up. Keep doing that. Which kind of got me thinking about, is acromegaly curable, or is it more like it's not a cure and you can go into remission or in and out? What's the story with that?
It's not curable. They don't have a cure yet, but you can attain remission. Not everybody does. Again, I was one of the lucky ones. Mine was caught early on. We even have a general idea of when it started. But people that have had, on average, it takes about 10 years for a diagnosis, usually.
Wow.
So by that time, the patient has suffered so much and they've dealt with facial changes. Their voices get deeper for women. They become like, it just really changes the way you look physically.
Your mental health is probably affected as well, I would imagine.
It's a really horrible, I mean, it's very depressing. Some people don't even want to go out in public. They've ended their social life. And it's very destructive.
Yeah. Well, I'm just sitting here listening to you, and I'm like, 10 years to diagnosis. That's insane, right? That it would take that long to do that. And, we hear of conditions of the past taking that long, but in present day, for anything to be taking that long to diagnose, that is a rarity, right? And it's because it is a rare disease, and there's just not a lot of education. And I feel like so many patients out there have to advocate for themselves. You did it in spite of yourself. You didn't know what you were doing. You advocated for yourself. But I'm guessing that people will listen to this and they're going to have some of these symptoms, right? Like, oh, I was feeling the same thing, or gosh, something's happening and this could be. How do people learn more about the disease so that they could bring that information to their doctor or get further help or assistance with the disease?
There's two places that I would recommend. The acromegalycommunity.org, their website, there's tremendous amount of information on there, and they do a tremendous amount of advocacy work as well.
Wonderful.
And you can also make donations there.
Fantastic.
Also, the pituitaryworldnews.org is another place to go, and that's actually hosted by my endocrinologist and his partner in this. But you'll see they don't just specialize in acromegaly, so they also concentrate on other pituitary disorders. So It's the full scope there.
So is the acromegalycommunity.org, is that more people who are diagnosed and coming together, or is it a combination of providers and community members and so forth? What's the demographics of that group?
So the acromegalycommunity.org, their website, is a general place anybody can go to. If you're looking for support and you've been diagnosed with acromegaly, they do have a Facebook page. You have to be admitted into it. But it's for people ultimately that are dealing with acromegaly and trying to find out, what do I do next, and looking for support.
Amazing. And then the pituitaryworldnews.org, you said it's started by your endocrinologist and his group, which is amazing. You're connected right at the hub. I like this. And so is this more a group of providers that are bringing together information on all diagnoses related to the pituitary? I should say the pituitary, in terms of different things that people could be experiencing and just getting the word out.
Yes. So that's they also put out a newsletter, but it's not a support group. It's for information gathering.
Got it. So information only, whereas the acromegaly community has a combination of all these things available for
Right.
people. Incredible.
And they interface too. They each are members of the same, so they do work together in a lot of cases. And the acromegaly community does hold an annual conference, and it's usually sponsored by one of the institutes. So they're having a meeting this year in Arizona at Barrows Institute, and so the people from Pituitary World News will be there as well.
Right. So, I mean, you go to these events and once people are there, they're in the situation, right? They've been diagnosed, they're coming together for support. But let's say I'm a listener right now, and I suspect I go online, I do my research. I'm thinking, wow, I need to get this checked out. Should they go to their primary care physician? What's the best first step to get the ball rolling, and how do they best advocate for themselves to move forward on this?
Yeah, if they're starting to experience this growth in their hands and feet, I also would suggest checking to see if their blood pressure's gotten higher or triglyceride, those counts have gone up. But they can bring it to the attention of their physician, and depending on whether you're in an HMO or a PPO, however that works, but you would request an endocrinologist to look into this.
They're going to be properly trained and able to do the right testing to see what's going on. So that's important.
Right. So, but the test that they want to have, that they want to insist on, is they want to get their growth hormone levels checked. And through growth hormone level and IGF-1 test.
Right. Simple test. And based on those results, it could save a lot of time and cut through, wouldn't you say?
True, because if your hormone levels aren't raised, then you don't have acromegaly.
Right, exactly.
You might have something else though. You might there are other pituitary things.
The problem, right? But it's one layer into the process. So I love that. So, well, I hope that this helps and people out there are learning more, because I certainly learned a ton, and you're amazing and such a success story. I love it. I bet there's people out there that says, well, I'm not suffering from this, but how could I help? What do you think the best thing to do for a donation would be?
They could send donations in on either both of the organizations, Pituitary World Network and Acromegaly Community. Both of them have spots to make donations.
Right.
And, I guess I'm trying to think of another way that they could make a difference. I think if they saw somebody down the street or somebody that they know that they think might have it, then they have to be very tender about it, but maybe they could share this video with them.
Absolutely. And so it's always hard conversations to have when you're thinking of someone else's healthcare, but this is the kind of advocacy that could save someone's life and improve the quality of their life so significantly. So I think that's incredible. Remind us, Monica, obviously people can be paying it forward with the information and if people make donations, but when the organization through the community takes in donations, how are those funds typically used? What kind of events, you touch on the events a little bit that people go to. Is it that people generally wouldn't be able to afford or have the accessibility of that and the funds help with it?
Yes. So on one side, I think on Pituitary World News, those donations probably go towards research and support of the website and their research. And the donations made at the Acromegaly community site go towards an educational fund. And so this, like I mentioned, they have these meetings once a year. And there's some people that are so ill and they can't afford to fly to where the meeting is or get there. And so these funds will help them get to these meetings, get the information they need, and even connect up with doctors that might be able to help them.
That's amazing.
Long distance.
The experts are coming in and corralling into one space, right? That's a great opportunity to get some support. Incredible.
And there's also other things out there, clinicals. So people that don't think they can afford medication, et cetera, clinicals are a great way to get the medication you need.
To get the access. So the support is there. That's incredible. I love it. And so I just hope out of this, Monica, from my perspective, if we can just help one person, I just think this is amazing and incredible. And I love learning about this. And I talk to a lot of people who are undergoing a lot of health conditions. And I know a lot of my audience does as well. So I hope we can pay it forward, just sharing information as well. And obviously sharing this video. I love it. We've gone over a lot. There's a lot of information. It's a heavy topic, right? I've learned a lot, and I know everybody else will too. If you could leave us with something, Monica, what do you think is the best take-home message?
Early diagnosis can save your life.
100%. Monica, thank you so much for joining. Thank you for this education, and I can't wait to spread this to our community and get some feedback on this. Thank you so much, Monica. Take care.
Thank you for the opportunity, Erin.